Next, I have the honor to introduce to you, it's really an honor and a privilege, our current NACo president and county commissioner in Tarrant County, Texas, the Honorable Roy Charles Brooks. Please welcome him to our stage.
Good morning, Virginia.
Good morning. Howdy.
Good morning, Dr. Gilmartin. Thank you for describing our state of being fully gruntled. I hope we're all fully gruntled this morning. I know that I am. It's a pleasure to be with you this morning in the beautiful state of Virginia. I've been to Virginia before, but just kind of around the edges. Some of y'all might say, I've been to Arlington. That doesn't really count. I mean, that's so DC. But driving from the Roanoke Airport to this beautiful place was really kind of a magical experience. I had no idea that the Lord had worked such beautiful magic in this place. And just seeing the leaves turning and the mountains thrusting up toward the sky, it made me gruntle. I want to thank VACo President Mary Biggs for not only her introduction, but for her leadership of this great organization. And thanks to Dinwiddie County Commissioner Harrison Moody. Where's Harrison? And Powhatan County Fire and Rescue Chief Steve Singer. Is Steve here?
No, he's not.
Both of these gentlemen served on the NACo Board of Directors. And I'd like to give a special thanks and tell you what a delightful experience it has been to serve with King George County Supervisor Ruby Bravo, who is NACo's Southern Region representative. We've served together for the past few months on NACo's executive committee, and y'all done good when you sent her to the NACo executive committee. And also to the inestimable Dean Lynch, Executive Director of VACo. Thank you to you and your staff for supporting NACo. 90 Virginia counties are NACo members. Thank you. Thank you for your trust in our national organization. Now at NACo, we are busy working on your behalf. We're busy working with the Congress, with the White House, with administrative agencies, trying to shape policies that affect people living in counties in America, and those of us who represent those people. We're active in several areas, not the least of which is federal policy. The federal policy agenda is packed with issues that impact counties. The President's policy agenda and efforts on Capitol Hill could affect counties and our residents in some pretty big ways. We're concerned that the proposed cuts in the President's budget could shift costs to the local level, especially for safety net services which counties provide. On the other hand, we're pleased to see the potential for regulatory reform. Several regulations are going back to the drawing board, and other unfunded mandates could be rolled back. Our nation is facing major challenges. The opioid crisis, jobs, health care, and infrastructure are just a few of those, and local governments need a strong federal partner to address these challenges. We're committed at NACo to continuing to work with the administration and Congress to communicate the potential impacts on the ground, with a particular focus on policy issues that affect the nation's 3,069 counties. We're focused on tax reform. We're focused on health care reform. We're focused on transportation and infrastructure. We're focused on behavioral health and criminal justice reform. And we're focused on strong consultation in the federal regulatory process. And in that federal regulatory process, EPA's Waters of the U.S., after years of advocating for a better definition of waters of the U.S., NACo was honored to participate as President Trump signed the executive order to revamp WOTUS. We support clean water and rules that make sense and can be implemented at the local level. Now, I gotta confess to you that I was in that room, standing about 6 feet from the President when he signed that executive order. This was early days in the administration, and we all had very high hopes for what was going on. At least some of us did. It was an interesting experience for me to stand there and watch the President take that act. There are many other federal regulations and unfunded mandates which we are addressing. For example, FEMA's disaster deductible proposal would require states and localities to meet certain mitigation requirements before receiving public assistance funds. Now, given the increasing cost of disasters, it has never been more important for our counties to take proper steps to protect people and property from all potential hazards. But we encourage you to urge your members of Congress to invest in mitigation activities at the state and local level. before there is a disaster, so that we won't have to pay such high costs on the tail end of that disaster happening. We are also advocating in Washington to preserve the full federal deductibility of state and local taxes, or SALT. The federal deductibility of state and local taxes has been in place since the original IRS Act was written in 1913. It is a bedrock principle of that act that governments don't tax each other. NACo has helped to launch a broad bipartisan coalition to preserve SALT, and it's called Americans Against Double Taxation. Not only does this coalition include state and local government groups, it also has members from other sectors that touch people's lives every day. School boards and superintendents, realtors, sheriffs, firefighters, and many more are members of this coalition. Eliminating or scaling back the SALT deduction would generate more than $1 trillion in additional federal revenue, which would translate to $1 trillion less money in local revenue to do local projects and perform local services. Make no mistake, this is a $1 trillion federal revenue grab, making it increasingly difficult for local governments to meet community needs. Almost 1.5 million Virginia households claim the SALT deduction for a total of $16 billion in 2015. In the current House plan, middle-class taxpayers who own a home in several parts of Virginia will see their taxes increase by as much as $2,300. Preserving the SALT deduction is a matter of keeping the tax code simple and fair, preventing residents from paying taxes on their taxes. NACo agrees with the goals of tax reform, boosting the national economy, excuse me, and lowering federal deficits. But we can't achieve these goals on the backs of middle-income homeowners and county governments. On health care reform, despite Congress's attempts to repeal and replace the Affordable Care Act, the debate and the nation's health care challenges are not going away. Counties are the health safety net, and federal funding for a series of important local health and human services programs expired this past September. These include the Children's Health Insurance Program, designed to cover uninsured children in families with incomes that are modest but too high to qualify for Medicaid. The maternal, infant, early childhood, and home visitation programs, which support pregnant women, families, and at-risk parents of children under the age of 5, are also at risk. And the Community Health Centers Fund, which supports neighborhood health centers in medically underserved areas, are also on the chopping block. And potential reductions in disproportionate share hospital allotments, which impact how many county hospitals receive partial compensation from the U.S. government for treating indigent patients, have also expired. While we were glad to see the U.S. House pass legislation last week, we are concerned about cutting funds to county public health departments, which is one of the offsets. The Senate must pass legislation by year's end to avoid all of these program disruptions. Counties are the front door to the nation's health system, and we know our communities best. We know that we are charged with providing health care to our indigent citizens. We know that it is our responsibility to provide this health care whether the federal government ever writes a check or not. We know these things. But we also know that if the federal government advocates its responsibility in this area, then there will be a giant sucking sound. And that sound will be the shift of cost from the federal government to our local taxpayers. And most of us live in counties and states where we don't have the ability to raise additional revenues to meet these additional costs. So contact your representatives and tell them we need a reliable federal partner or the system breaks down entirely. Now, NACo is also involved in providing counties with cost-saving solutions. We want to thank VACo for endorsing NACo's premier cost-saving programs, including our deferred compensation program with Nationwide, the U.S. Communities Government Purchasing Alliance, and the Live Healthy prescription health and dental programs. The deferred comp program with Nationwide has helped 1.5 million county employees across this country and retirees save $17 billion extra for retirement. 67 Virginia counties participate, and employees and retirees in those counties have accumulated more than $154 million in additional retirement assets. 74 Virginia counties participate in the U.S. Communities Purchasing Alliance, saving an estimated $36 million through this purchasing cooperative that reduces your costs for county goods and services. And the Live Healthy prescription health and dental discount program includes 62 Virginia counties whose residents have saved over $17 million on their prescriptions. These are real savings that you are able to deliver to your residents by participating at no cost in these NACo programs. So I'm getting the time is up. Sign from Dean. But before I sit down, let me talk to you about my NACo presidential initiative. every president of NACo is entitled to pick a presidential initiative and to focus the attention and the assets of NACo on moving the needle on that initiative during that presidential year. I have selected serving the underserved, counties addressing poverty in America. Now, there are many faces of poverty in America. Poverty is urban. Poverty is rural. Poverty is suburban. And it affects just about everybody. But especially, it affects our children. So during the next year, we will be working with counties across America to help focus you and your resources on improving our human infrastructure, just like we focus on our capital infrastructure. We will be focusing on children from 0 to 3 years old. We will be focusing on ways to stimulate their brains so that by the time they reach pre-K, they are ready to learn. We will be focusing on dealing with the effects of childhood trauma, which can, if left untreated, affect the entire life course of a child. We will be showing you ways to address these conditions with your existing resources. We will be advocating for legislation that allows counties to do more of this kind of work. And we will be giving you technical assistance to help you along the path. Poverty is endemic in America. There are still communities who have not yet recovered from the Great Recession of 2008. We as counties must take an active role in mitigating those conditions. So I ask you to join with NACo, to join with this organization that represents you, this organization that is you. NACo is you. You are NACo. Let's join together and see if we can't make a difference for our children, for future generations. And just by the way, we'll save money in the long run. As that old saying, pay me now or pay me later. I like the pay me now option because the early money always costs less. Thank you for the invitation to speak with you today. Thank you for listening to what I have had to say. And I hope that you are still fully gruntled and full of gust.